my name's AJ. I'm going to be your nurse today, and I'll be assessing you.
Okay.
Okay, so first we're going to look at your skin. Do you have any history of eczema or allergies?
No.
Any changes in your moles?
No.
None of them are bigger?
Not that I've noticed.
Have you noticed your skin is drier or more moist than usual?
No.
Any itching?
No.
Any excess bruising?
No.
What medications do you take for your skin, hair, or nails?
I don't take any. I use like a daily moisturizer though.
Have you noticed any hair loss?
No.
Okay. Do you have any environmental hazards or occupational hazards?
No.
Okay. And do you wash your skin, hair, and nails regularly?
Yes.
Okay. All right. Well, it looks like your color's pretty pinkish and normal. Looks like you have some freckling.
Mm-hmm.
I don't notice any jaundice or blue areas. You notice any color changes?
No.
Alright, I'm going to get my gloves on. Nice gloves. Okay. You feel warm. Alright. Doesn't look like you have any excess moisture anywhere. Smooth and firm. See the thickness. Seems to be regular. You don't have calluses or any thick places. I don't notice any swelling. Your skin turgor is good. You appear to be clean. And I don't see any bruising. I've seen no lesions anywhere on you. Let's check out your hair. Ooh, I see some gray. No gray, so the melatonin production seems to be normal. It's consistent. Good color throughout. Okay, good texture. I don't notice any excess body hair. And you didn't have any scalp lesions or dandruff. Alright, as far as your fingernails, they look round. The nail beds are pink and they're translucent. There's no clubbing. Your capillary refill is less than 2 seconds, which is good. Don't notice that they're brittle or splitting. Let's put your nail together. Yeah, no clubbing. Your nails look great. Probably have good oxygenation. Alright, so at home, once a month, you should undress and look at your whole body in a full mirror and then use a handheld mirror to see the parts that you can't see. And be sure to look in your fingers, your heels, if you notice any moles, elbows, thighs, legs. You can use a hair dryer to look at your hair. Any questions?
No, thank you.
Alright, now we're going to go for your head. Have you noticed any headaches?
Just occasionally.
Okay. Are they worse than normal?
No.
Okay. Any head injuries?
No.
Dizziness?
No.
Neck pain?
No.
Limitation of movement?
No.
Any swelling?
No.
Have you had any head or neck surgery?
No.
Oh, perfect. Alright, well let's see what your scalp looks like. Alright, feels smooth, normal. Don't notice any lumps, tenderness, or deformities. Let's see your temporal artery. Alright, looks good. Alright, can you open your mouth for me and close it? Alright. Now can you smile for me? Can you open your eyes big, close them? Alright. So you have symmetrical facial expressions. Your eyebrows and the sides of your mouth seem to look the same, and I'm not noticing any ticking or blinking or any involuntary movement. Alright, as far as your neck, Can I have you touch your chin to your chest? Okay. Can you turn from side to side? All right. And then touch your ears to your shoulder and try to extend your neck backwards. All right, great. Did any of that hurt?
No.
All right. Let's feel for your lymph nodes. All right, there's 10 different lymph nodes. I don't notice any of them are swollen. So now I'm going to check for your thyroid gland. I'm going to give you some water and let you swallow. I'm going to stand behind you, and it'll be kind of awkward, but I'm just going to feel.
Okay.
So here's a cup of water.
Drink now?
Sure. You can swallow when you're ready. All right. I didn't notice any irregularity. I can't feel your thyroid, which means it's not enlarged, which is a good thing. And I felt that your trachea was right where it's supposed to be, in the middle. Do you have any questions about that part?
No.
Okay. Then I'm going to check out your eyes. Have you noticed any blurry vision? Any changes in your vision?
No.
How about blind spots?
No, not that I know of.
No pain?
No.
Double vision?
No.
Any redness or swelling?
No.
Any discharge?
No.
Do you wear glasses?
Yes.
Okay. Do you have them on?
I have my contacts in.
Okay. Well, we're going to start with a visual test. So I'm going to have you stand up.
Okay.
And they're 20 feet away. I have a Snellen eye chart. So what I'm going to have you do is cover one eye at a time. And if you could just read me what you see on that chart.
EFPTOZ,
All right, 20/20 in that eye. Let's try the other one. Okay, perfect. So you have 20/20 vision while you're wearing your glasses in both eyes. And because your vision is good and you're not 40, we don't have to do the near vision test. So now we're going to do a visual field test. I'm going to have you cover one eye and look at me, and I'm going to cover one of my eyes. You can hold it.
Okay.
And then I want you to tell me when you can see my finger.
I can see it. I can see it. I can see it.
All right. You can take that down. So you can see on both sides. That side was great. All right. Tell me now.
I can see. I can see. Yes. Yes. Yes.
Perfect. All right. So that was 50% upwards, 90 degrees temporal, 70 degrees downward, and 60 degrees nasally. All right, now I'm going to check out your cornea. This might be a little awkward. Just look straight, and I'm just going to shine the light by your eyes. All right, and I saw a white dot, equal places on both eyes. I'm going to have you just look straight ahead. All right, I'm not noticing any gaze deviations. You have a normal gaze. Now I'm going to have you follow my finger. All right, you can see all 6 cardinal positions of gaze, which is great. Right, your facial expressions are normal and you haven't squinted throughout this conversation. As far as eyebrows, can you raise them up? Okay, they're equal. Your eyelashes look intact. I don't see any redness in your eyes. No discharge or lesions. And your eyeballs aren't protruding and they're not sunken. All right, I'm going to have you look up. I'm going to look at your sclera. All right. Perfect. Your eyeballs look moist, glossy. I can see all the vessels and I don't see any swelling or lesions. I'm going to have you look down. I'm going to look at your lacrimal apparatus. Right. Any pain right now?
No.
Okay, perfect. No swelling. I'm going to check out your cornea. You just look straight. This is also a little uncomfortable. And get my light to work. That'll be wonderful.
It's working.
Oh, okay. Perfect. All right. No cloudiness. They both look very smooth. Eyes are round. Reactive. They look like about 4 centimeters before light, and then alright, about 2 with light, 4 centimeters before, millimeters rather, and then 2 with light. They're both equal, round, and reactive. I'm going to have you focus. Look really far at that sign on the wall, and then look at my thumb real quick. Alright, they accommodate very well. Now, we just used the ophthalmoscope when we were in the dark over there.
Mm-hmm.
And while we were in there, I noticed that the color was a creamy, yellowy orange, which is great, and that your eyes were round, the ocular fundus, and it appeared very sharp and distinct. And the cup disc ratio was more than 1/2 disc diameter, which is great. As far as your retinal vessels, they were paired up artery to vein in every quadrant, which is what we're looking for. The arteries appeared a little brighter than the veins, and there were about 2 arteries for every 3 veins. There was a regular decrease in the caliber as we extended to your periphery. There were no indentations or displacements, no twisting vessels, and the pulsations were present. They were a little difficult to see. And as far as the general background, I didn't notice any lesions, and your eye color is great. The macula is a little bit darker than the fundus, but that's what we're looking for. So do you have any questions about that?
No, thank you.
Okay, now we're going to check out your ears.
Okay.
Do you have any ear aches,
No.
ear infections, discharge,
No.
hearing loss?
No.
How do you clean your ears?
Q-tips.
Okay, well, you're not really supposed to do that, but we'll talk about that later. Alright, so as far as your external ears, I'm going to check them out. Alright, they're normal size. I don't see any swelling. Are they tender at all?
No.
Okay, great. They are aligned right under your brow line, which is right where they need to be. They're even. I didn't see any lumps or lesions. I'm going to feel for pain. Anything hurt?
Mm-mm.
Any tenderness when I pull on that? Okay. And I didn't notice any discharge, and there were no foreign bodies in your ears, so good job
That's
not putting
great.
anything in your ears today. Alright, check out your ears. My otoscopic light seems to be damaged, so I'll be using this one. So I'm going to check out the external canal. Pull it. Alright. Oh, lovely. Okay. So, I didn't notice any discharge. It looks pretty good. There's no redness or swelling in the canal walls. As far as the tympanic membrane, which we can see, it's shiny. It's got a little gray color, which is normal, and it's pretty flattened. It pulls a little. That's good. And I didn't notice that it was perforated at all, which means it's intact. Has good integrity. And are you having any problems hearing right now?
No.
Okay, great. So your conversational speech is fine, so I won't have to do a whispered test, which we would have to do if you were having problems. And we used to do the Weber and the Rhine tuning fork test, but recent evidence has shown that doesn't really matter, so we don't have to do that today.
That's great.
Lucky you. All right, so we're going to move right along to your mouth, nose, and throat. Have you had any discharge in your nose?
No.
Any colds or sinus pain?
No.
How about any nose trauma? Have you been in any fights lately?
No, no fights.
Okay, good.
No
Bump
blades.
nosebleeds. Allergies?
No.
Any trouble smelling?
No.
Okay, well let me check your nose out. Oh, it looks pretty normal. Great. No lesions, deformities, you're symmetrical. It's in the middle of your face, so I believe you haven't been in any fights. Alright, so I'm going to hold on your nostril. Can you blow out with the other? Alright, perfect. So you don't have a cold right now. Okay, it appeared a normal color, smooth, moist. I didn't notice your nose was bleeding. It's good news. Your septum is there, so you haven't been doing any cocaine.
Yeah.
It's good to know. Your turbinates were also there. They look great. I'm going to feel your sinuses, and I need you to tell me if you feel any tenderness, okay?
Okay.
All right. Any tenderness?
No tenderness.
Perfect. I didn't feel any abnormalities in the transillumination sinus we used to feel as well, but evidence now tells us that doesn't matter either. So, keeping up with the times.
Mm-hmm.
Okay, how about your mouth and throat? Any sore throat?
No.
Bleeding gums?
No.
Toothache?
No.
Hoarseness?
No.
Dysphagia, problem swallowing?
No.
Have things been tasting different?
No.
Do you go to the dentist?
Yes.
How often?
Every 6 months.
Perfect. And do you wear dentures?
No.
Okay. Do you smoke?
No.
Do you drink alcohol?
Occasionally.
How occasionally?
Like once a month.
Okay, perfect. All right. Well, I'm going to be checking out your mouth. Let's see here. Okay. We're going to get this tongue blade. Your lips look good. I didn't notice any cracking. The color's great, and they looked moist. Your teeth were white, evenly spaced, and clean, so I do believe you that you go to the dentist. Your gums were not bleeding, not swollen. Can I have you touch your tongue to the roof of your mouth? Alright. Kind of pink. Don't notice any white spots or lesions. You can close your mouth. And have you swing it out from side to side, your tongue. Okay, no patches that way either. Perfect. I'm going to hold your cheek open and I'm going to keep looking. Okay, can you say ah? Okay, perfect. Your uvula is not swollen, so it's a good thing. As you said, ah, and your tonsils are not either, so I'd give them a +1 score. Your pharyngeal wall looks great, pink as well. Your tongue looked good. Your Stinson's duct looked great as well, up at the top. And then the Wharton's duct I looked at when you had your tongue up. And it's exactly where it should be, and your trachea is right where it needs to sit too. Do you have any questions?
No. That's
Perfect.
great.
Well, thank you.
Thank you.
And I will we'll discuss this in a little while.
Okay.